So my goal for any client that I'm working with, that when asked, they know exactly what they're working on, specifically for treatment goals. All right, I'm Ebony Hicks, behavioral health therapist with the West Baltimore team for Healthcare for the Homeless.
Thank you. What do you love most about using care plans?
For me, it keeps me on task. Sometimes, especially when clients are coming in, they have so many fires to put out, and sometimes it can cross lanes between therapy and case management, or even sometimes medical. It can help me stay on task about what are we focused on as far as the problem areas, and really guides the client to know that everything we're doing is intentional and has a purpose.
Okay. So how do you incorporate enrolling clients into care management into your everyday workflow?
So first off, anybody that has any kind of depression diagnosis, I'll ask them if they're okay with being in it, then I'll enroll them. And then we go through, because with the treatment goals, it's tied in there, so we go through each session, kind of checking in, let's remind you about what your treatment goals are, and let's have an honest assessment of how they're progressing or not progressing, and if we have to kind of go back to the drawing board and kind of tweak some things to make them more realistic or whatever.
You have to pivot.
Yes. And like I said, it's just very good to have clients be guided, because it can, especially in this session, can go really left or far off, and okay, let's really just make sure we're here with a purpose and actually focus on that purpose.
Yes, definitely. So you do a wonderful job coming up with SMART goals for your clients. Can you give some examples of some goals that you've set with your clients and how you set them?
So first, I'm big on baselines, like where are you now? So from the beginning we do, where would you like to go? But I'm really focused on where are you now and where are we trying to get you to go, and not do these leaps, but actually do in a very realistic manner of where can you see yourself in the next 6 months. So that 6 months part, we can say, oh yeah, I'd like to do this in a year or so, but for 6 months, let's really try to be very realistic about where can you go in that. So for instance, like if you now say, I don't really have any effective coping skills, I would say, let's get 10 coping skills. I'm good with number 3. I feel like 3 is a good solid way for clients to have something where they can have tools that go from 0 to 3 within a 6-month period versus trying to do too much and be overwhelming. And for any humans, when we get overwhelmed, we just tend to throw in the towel and say forget it. So I'm really good with making a client know, okay, this is your baseline, so let's be realistic, and is 1, is 3, or whatever intervention is realistic. And like an example of one would be like I said, a client has no coping skills, so now let's do 3 things we know you can go to. Like you have almost like your tool bag that you can implement within the 6-month period to try to, deal with like your anxiety, your depression, whatever you're dealing with outside of this office.
Yeah, that definitely makes sense. Do you have any other tips around keeping goals concrete and realistic, yet helpful at the same time?
Yes, because with SMART goals, they have to be measurable.
Yeah.
And so that actually kind of helps, as much as it kind of irritates me too, because they have to be measurable. But it's good with helping the clients make it concrete. So if I'll just give an example, even with smoking. If you smoke 10 cigarettes from the beginning, and we want to be concrete and say, well, okay, you smoke 10 cigarettes a day. It won't be realistic to say let's go from 10 to 0 in 6 months. Maybe we'll say you'll cut that by half. So that's the way are we on point with where we're going? Is it something we can actually be concrete about? We know and clients have to be honest. Are you now not smoking 10? Are you now doing 5? Or so it's concrete where you can actually put your finger and pinpoint what is the measurable there.
And you can sort of plot a trajectory of where your client's going, where they've been,
Exactly.
and what is a reasonable trajectory for them.
And kind of again visit where the pitfalls, where is this not being realistic with, or where the bumps coming in that's kind of veering you off from even making that concrete marker.
Yeah. So it sounds like care plans are essentially a scaffolding around which you can keep the client on track.
Yes, and I really think it's so important to every session to look at it, because one, I noticed it really encourages clients to feel oh, I am making progress. Or I was just saying, to kind of visit where maybe did we kind of fall short, or we not really on the right road to get you to this goal. So having it every session to kind of know you have to check off if it's progressing, regressing, or no change, that's super helpful with just where are we on the mark.
Yeah. How do you and clients in conjunction come up with care plan goals?
So I like to introduce the whole process for clients, especially anybody new to therapy, that from the beginning we're going to do all these assessments, and then by usually about the 3rd meeting we're going to have to make your treatment plan. So in their mind, they already know from our very first interaction goals are where we're going to eventually go with. And so by the time we get to the treatment plan, they know that now I'm going to map out for you like what a SMART goal is, but it's going to be your goal, and I'm just kind of like helping you get to it. So goals from the very first interaction I had with the client are mentioned, because I think that's what differentiates a counselor versus like somebody from the outside, like a friend or a family member. That, yeah, you can come here to a safe space to vent and problem solve, but we have to be focused on where we're trying to go with your mental wellness overall. So the treatment plan really helps with that.
Yeah, it has to be directional.
Exactly. So that way, an hour out your day you're not wasting by coming here like, oh, it was nice talking to her, but what did we actually accomplish? Exactly.
Yeah. You mentioned bringing up to clients when they've met or achieved their goal. How do clients generally respond when you bring that up?
So again, with going through it every session, it's usually not surprised with the way they're progressing, whether it's going forward or backward or no change. But when I see clients who are actually like achieving goals, and we update our treatment plan and they keep continuing it, I point out like this might be a good time to start talking about weaning down therapy and eventually termination. And I think that's a good way too, because a lot of clients don't want to end therapy. As hard as it is sometimes to get clients engaged, a lot of times they're so used to this therapy relationship and having this time and space that they don't want to end therapy. So that's a good concrete way to say, hey, remember we made these goals? You've knocked all these goals out. You're at a good place. And then when we're trying to update, I've seen clients struggle with like, oh, I can't even think of another goal. So to me, that points to it's probably time now to work towards ending it. So I think that's a nice, safe way to kind of point out to clients that you made these wonderful progresses. Like, it's okay. We can part and revisit if we need to. I don't plan on going anywhere. So if you want to come back, we can always do that. But it's a very concrete way to say, hey, I'm not just, kicking you out of the therapeutic process. You've accomplished these wonderful goals. You've done it.
That's fantastic. All right. Do you have any other comments about care plans? Anything that you?
I think the best way to, because I know I was questioning about, well, how do you remember to do it? It's just to get in the habit of every session clicking it. It just becomes like muscle memory. It becomes like the back of your hand. You just kind of do it. You click on it and you update it. It's become so second nature to me. I really don't even think about it.
Like any other part of the visit then?
Yes, exactly.
All right. Well, thank you so much, Ebony, for your time. I really appreciate it.
Thank you.